Good morning or good evening, everyone. My name is Sara Mantovani. I'm a freelance physiotherapist based in Brescia, Italy. With my team, I work with people with lipedema and lymphedema in different cities in Italy. In particular, I treat women with lipedema at any stage, conservative, pre-surgery, and after surgery. Today, I'd like to share with you some idea about complex decongestive therapy or CDT in lipedema, when we use it and why we choose one or more components of CDT. I try to base my presentation on available literature and clinical experience of myself and my team. Let's start. We know that CDT is the gold standard in lymphedema treatment, but lipedema is not lymphedema. The components of CDT are manual lymphatic drainage or intermittent pneumatic pressure, compression, short stretch bandages or garments, skin care and exercise with compression. The aim of CDT in lymphedema is reduce volume, reduce edema of the interest limb. So, when we use CDT in lipedema, what are the aims of CDT in lipedema? I think it is very important to have a multidisciplinary evaluation before starting treatment in lipedema. After this, we can choose which part of CDT to offer for that particular patient. We can use CDT in conservative treatment and after surgery. After surgery, it is essential to start early with a complete CDT program. In our team experience, conservative treatment always includes compression garment, flat or round knit and type depending on patient evaluation, physical exercise, walking, resistance training, water workout, and skin care. Sometimes we even include MLD or IPC and short stretch bandages. What are the aims of these treatments? Compression garments reduce pain, inflammation and edema of the limbs. The pressure is graduated and this improves venous and lymphatic flow. Compression garments can also provide tissue support, especially in presence of important adipose masses. On the other hand, they are not always well tolerated and easy to wear. In these cases, it may be better to use tailored garments. The benefits of physical activity are known and studied. Physical exercise improves venous and lymphatic flow, bone density, and muscle mass and strength. Although more studies on lipedema are needed, we know that exercise reduces inflammation and pain. Adequate skin care is useful in increasing the resistance of the skin and therefore reducing the risk of infections. Introducing a self-care routine also has psychological benefits that can be important for those suffering from lipedema. There is no agreement on the utility of MLD in lipedema. The present literature tells us that MLD can be useful for reducing capillary fragility and pain. It can also have psychological benefits. It will be important to be careful not to make the patient dependent on therapists. Therefore, it can be used for short periods and taught to the patient as a self-treatment. Intermittent pneumatic compressions seems to improve MLD benefits and may be that can be used for home treatment. It may be that it also benefits on pain from the compression it exerts. Short stretch bandages are used to reduce pain and edema and to prepare limbs to decompression garments. We can start with low pressure and increase it gradually. In our clinical practice, we use bandages with MLD when there are important signs and symptoms, like eye pain, heaviness, swelling, bruising, or presence of edema on instrumental evaluation, segmental bioimpedance analysis, soft tissue ultrasound, and other. After lipedema surgery, it is very important to start early with a complete CDT program. The published consensus document on lipedema surgery 2019 indicates manual lymphatic drainage, compression garments, and ultrasound as post-surgery treatments. In our team experience, CDT is a priority after surgery. We start on day 0 with MLD, direct towards wound soles, wound care and short stretch bandage and compression garments. In the following days, you also start with simple exercises, slow limbs movement, walking, and with exercise in the water as soon as possible. CDT continues for the first 2 weeks with a high frequency, every day or 3-4 times per week, and then decreases according to the patient's recovery. This approach reduces edema and hematoma and allows faster recovery. This concludes my presentation. However, I'd like to share with you 2 personal thoughts. Teamwork and multidisciplinary approach are mandatory in lipedema treatment, and further studies are needed on lipedema, conservative and post-surgical treatment. Finally, if you want to share with me some experience or thoughts, or if you have some questions, these are my contacts. Thank you so much for your interest and attention.